Hello and welcome to I Got You, your go-to for honest, simple conversations about vision, eye health, and general wellness. I'm your host, Dr. Valarie Jerome Optometrist and total eye nerd. No jargon, no hype, just real talk, grounded in care and expertise. Because your eyes matter, and so do you. This is a space where you're going to feel heard, seen, and supported. And you're going to get some information that you can actually use. So don't worry, I got you. Welcome to the podcast show where we're keeping an eye on your wellness one blink at a time. I'm Dr. Valarie Jerome, optometrist and total eye nerd. Today, we're going back to basics with something that a lot of people skip or put off, the eye exam. Not the most exciting thing I know, but whether you've worn glasses your whole life or you've never stepped foot in an optometrist's office, this episode is for you. Let me just say, you can choose to get your routine eye care with an ophthalmologist, but today, you'll hear me use the word optometrist as that's what I am. So today we're going to be talking about why regular eye exams are so important, what really happens during one, and a few things you might not expect, but totally should. So let's clear things up. Literally. Okay, let's be real. A lot of people think I can see fine. Why should I go in for an eye exam? I cannot tell you the number of times that I hear this year after year, and oftentimes from family and friends. So here's the deal. An eye exam is way more about checking if you need glasses. You've heard eyes are a window into your soul? Well, they're also a window into your overall health. Your eyes can detect early signs of diseases like diabetes, high blood pressure, high cholesterol, thyroid disease, multiple sclerosis, rheumatoid arthritis, cancers, sexually transmitted disease, even brain tumors or autoimmune conditions. And for eye-specific issues, routine eye exams can catch glaucoma, which often has no symptoms until vision is lost, macular degeneration, cataracts, dry eye syndrome, and yes, it will detect changes in your prescription. The key here is early detection. You might feel totally fine and still have something developing silently. So you've made the appointment. What should you expect? Well, I'm going to walk you through it step by step. This can vary for each type of appointment. For the general routine eye exam, this is usually how it goes. You'll come in to be greeted. So new patients may fill out forms. We'll get details about you, your health history, your eye health history, and these might include forms to make you aware of how payments are taken, let you know how we handle your privacy, and confirm you're happy for us to contact you. Returning patients can confirm details are still current, and in my practice, we give everyone a dry eye questionnaire to fill out because we see a lot of dry eye patients. We'll also ask you about your current glasses prescription. We will measure those. We'll see what you've currently been wearing. We'll ask you for copies of your prescription, of your glasses, and ask for your contact lens information, and we can scan that into your records. And at my practice, we'll offer you a tea or coffee or water. Next up is the medical history and symptoms chat. Your optometrist or tech will ask you about any changes to your vision that you've had, if you're having any signs of flashes of light or floating spots or double vision, if you have any headaches, if you have any eye strain, if you're taking any medications, allergic to any medications, if you have any eye problems or any injuries to your eyes in the past. Is there any history of any eye problems in your family? And one of the questions I always ask is, if I could change anything about your vision or eye health, what would it be? Please, everyone be honest with your optometrist. This sets the tone for the rest of the exam. Don't be that one that's trying to quiz to see if we get the right answer. If you don't trust the optometrist or their staff, then please go somewhere else. Then next up is preliminary tests that happen before the actual eye exam. You may look in a machine with a hot air balloon down a long road. That's called an autorefractor keratometer. We'll take some pictures of the back of the eye, maybe get some scans of the front and the back of the eye. That gives us information about the retina and the optic nerve and the macula. You may look at this machine with red circles that makes you feel like you're getting hypnotized a bit. That's called a topographer. In my practice, I use something called a DNI scanner. This tells me how your eyes are affected by glare. And then there's the peripheral vision check, either by just counting numbers to the side that you see or looking into a device that is honestly the most boring video game ever. And then there's the dreaded air puff test. That's a glaucoma check. That keeps some people away from coming back for the eye exam, but this gives us some vital information. I do it with a much nicer device called an eye care with no blast of air. You may get it done with eye drops and looking at a blue light. Up next is the visual acuity test. Now, this is the classic one. This is reading the letters off a chart across the room. They'll test one eye at a time, and we'll see how well you focus at the distance. So remember this, everyone. Don't cheat. Don't try to cheat and look through the hole. Look out the occluder. And don't worry, parents. If the kid's reading some random letters up there, don't worry. We'll come to that in a later episode about kids and eye test. If you've got on bifocals, varifocals, or progressives, make sure you're not sitting up too tall because you're looking through the wrong part. Make sure your head is focused like this, and so you're looking through the top of their lenses, and don't read your reading glasses when you're reading the chart. Up next is the refraction test. Ah, yes, the better one or better two moment. There'll be some lenses switched in front of your eyes to see what your answers are to help you get the most accurate prescription. It's low-key stressful, but if you're indecisive, it could probably be a lot stressful. Don't worry. We've got lots of ways to double check it. Just remember, don't stress, and we can always show it to you again. Up next is the eye muscle test. So this checks to see how your eyes are working or not working together, how well the eyes move. You might follow a pen or a light with your eyes. It's quick, but it helps catch issues with eye alignment. And then there's the slit lamp exam. This is my favorite. This is with the microscope that we put in front of your face. I call it Wall-E because I think it looks like Wall-E from the back. It lets the optometrist look closely at the front of the eyes. We look at your lashes, your lids, your tears, your cornea, the front chamber of the eye, the iris, which is the colored part of the eye, the lens that sits behind it. We're going to be checking for issues like inflammation, infection, cataracts, injuries, or dryness. You may have some eye drops put in your eyes to see how quick your tears evaporate. That's to check for dryness of the eyes. It's harmless, that bright light from that microscope, but it's really bright. But don't worry. It's not going to hurt you. Just blink it out. If you need to take breaks, just let us know. We also can look into the back of the eye with that microscope if we hold up a little lens in front of the eye. This helps us look into the back of the eye to check the gel of the back of the eye, the retina, including the macula, your optic nerve. Now, the best position for a slit lamp is you want to keep your bum all the way back in the chair and lean forward. You're going to rest your chin on the chin rest and the forehead on the bar. Keep your hands in your lap. Sometimes we might touch them or squeeze them in the little devices. We're rolling it up and down. This is the best position, and this helps the exam to go much easier. If the slit lamp test isn't done, they'll be holding that handheld device right up close to your eyes, a little bit open, close, and personal, and let's hope the optometrist brushed their teeth after lunch that day. Up next, there's pupil dilation. This may or may not be done every time you come in, but pupil dilation is where we put drops inside the eyes to make your pupils bigger so we can see into the back of the eye. And this is how we examine your retina a bit further. One of the times this has to be done is if you have any complaints of flashes of light, floating spots, or sudden loss of vision, we're going to do this. Now, just to warn you, you're going to be really light sensitive and blurry up close and a little bit in the distance for a few hours afterwards. So make sure to not do any social media scrolling afterwards, and probably don't drive, and bring your sonnies for that appointment. How often should you get an eye exam? Well, here's a quick guide, and country to country it can vary with guidance with country to country, but here's my general recommendation. So at birth, there'll be a screening done in the hospital, and if you'll be referred if there's any issues found. For kids up to 18, so sometimes they'll have it done with their pediatrician, a health visitor, GP. There may be someone looking at them, but I definitely recommend an eye exam with an optometrist by the age of 4. And remember, school screenings are not an eye exam. For adults, 18 to 40, every 1 to 2 years, 40 to 60, every year or as recommended. You could go up to 2. And then over 60, ideally every year, because that's when your risk of eye conditions like cataracts goes up. Here's the thing, if something feels off, don't wait. And here's my red flag list. This means you have to be seen right away with someone with a microscope to look in your eye. Please don't go to the GP or the pharmacist for this, because if you've got anything on this red flag list, you need to be looked at by an optometrist or an ophthalmologist. If you've got red eyes, pain in the eyes, fast onset of blurred vision or vision loss without pain, new floaters, flashes of light, If you've got a white spot that shows up on the front part of the eye, especially for contact lens wearers, that's a red flag. If you suddenly become sensitive to light, if you have a curtain or a veil that comes up or down over the vision, if you've had sudden onset of double vision, or if you've had an injury to the eyes, please don't hesitate. Get seen straight away. So the next time someone says, well, I haven't had an eye exam in years, hit them with the facts. Your eyes are not just windows to the soul, they're windows to your health. And eye exams aren't scary. They're quick and painless, apart from the air puff and the bright light. But honestly, I think they're kind of cool when you realize how much they can reveal and you see all the cool gadgets we have. So go ahead and make that appointment. Your future self and your future sight will thank you. And if you have any anxieties, health anxieties, eye phobias, I've seen people with eye phobias before. If you have special needs, whether that be seen or unseen, let the practice know before you attend so that they can make your visit as relaxed as possible. And if they don't seem to want to accommodate you, go somewhere else, because there's plenty of caring optometrists out there. Thanks for listening, and be sure to follow the show. Drop a review if you're feeling generous, and I'll catch you next time. Thank you so very much for listening to the I Got You podcast with myself, Dr. Valarie Jerome. Just a little reminder, everything that we chat about here on this podcast is for info and entertainment purposes only. So if something's a little blurry, itchy, or not quite right with your eyes, book in an eye exam with your eye care provider. Take care of yourself and take care of your eyes.